name is Ashley, and today I'm going to inform you about the differences between a midwife and an obstetrician gynecologist doctor, which is commonly referred to as an OBGYN. So you can choose which is the right one that would work best for you and your family. People say that love is blind, and I'm not too sure about that. But I am sure that labor is the only blind date where without fail, you will meet the love of your life. While doing my studies, I have put in hours and hours studying about the roles of a midwife and an OBGYN and the relationship that they have with their patients. Choosing between the two can be a very hard decision, but as you become more educated on the differences and roles, you will be much more confident in choosing between the two. As soon as you find out you're pregnant, there are so many questions that come your way. I'm going to give you some insight on an OBGYN and what they have to offer, and we are going to look into the life of a midwife and see all that she has to offer. So you're pregnant. Now what? Here are a few things to take into consideration. Will you give birth in a hospital, a birthing center, or the comfort of your own home? You are definitely going to wonder what type of practitioner is going to deliver that sweet baby. Along with that, what type of pain management are you going to use? An epidural, which allows you to rest, laughing gas, which helps soothe pain, or all natural and maybe something like a warm bath to lower stress, blood pressure, and pain. It's not about whether you choose an OBGYN or a midwife. It's about the awareness, comfort, preference when it comes down to the ultimate decision. Here is the OBGYN package and everything it involves. OBGYN doctors complete 4 years of medical school and then enter into a 4-year residency program. In the residency program, they work as a doctor, but under a doctor, just to make sure they are completely prepared for what they signed up for in the long run. OBGYNs care for women who have more of a high-risk pregnancy. Complications will vary, but it could be something similar to as if you have to have a C-section. They also provide preconceptual care, which is before pregnancy, along with delivery and postpartum care in the coming weeks after birth. OBGYNs take a conventional approach with appointments every 2 to 4 weeks, and as you approach the end of your pregnancy, it will be weekly, which is pretty much the only time you will see them. It's the most powerful creation to have life growing inside you. There's no greater gift. So here's a midwife package and everything it involves. Midwives usually become nurses and get some job training. After they put in so many hours, they can further their education, which is about 1.5 years, and then become certified as a midwife. Or they can opt for a 3-year program and become certified that way as well. Midwives care for women who have low-risk pregnancies, which really have no issues and are pretty smooth sailing, along with preconceptual care, which is before pregnancy and the actual delivery, then postpartum care for weeks after the birth of the baby. A midwife will get to know you, your family, and your preferences over your pregnancy. You'll want to choose a doctor for your prenatal care and delivery if you have a high-risk pregnancy. If an individual approach with fewer medical interventions is important to you, you want to consider a midwife. Where you want to give birth, a hospital, birthing center, or home is another important factor. Most women choose an OBGYN, but certified nurse midwives are becoming increasingly popular, says Miles from Baby Center. So with this, take into account all your questions and concerns, Remember everything an OBGYN offers and everything a midwife offers. Both professionals are very well versed in prenatal care. But as soon as you scour the internet, you'll find that some people are firmly Team OBGYN or Team Midwife, says Smith Garcia from Healthline Parenthood. And remember, a baby is someone you carry inside for 9 months, in your arms for 3 years, and in your heart for eternity.